Good morning, everyone, and thank you for tuning in to our webinar today, Singapore's War on Diabetes, the Deep Tech Story, presented by SGInnovate in support of Deep Tech for Good. My name is Brian, and for those of you who don't know about us, we are a government-owned organization in Singapore that invests in and helps build deep tech startups, talent, and communities. At SGInnovate, our work involves connecting with the global deep tech ecosystem, working with entrepreneurial scientists to bring their innovative research from lab to market, as well as developing deep tech talent. Today, we have a group of amazing speakers who will be discussing Singapore's progress in the war on diabetes and the role tech has to play in the prevention, diagnosis, control, and treatment of diabetes. I'd like to encourage our audience here today to share their thoughts on this topic and engage with our speakers by using the Q&A box below. I would like to introduce our moderator for today, Dr. Kalpana. Dr. Kalpana wears many hats. She's the head of the Center of Applied Nutrition Services and Glycemic Index Research Unit at Temasek Polytechnic. She's also the president of Diabetes Singapore and vice president of Singapore Nutrition Dietetics Association. And with no further ado, I'll now pass the time to our moderator for today, Kalpana. Kalpana, please. Oh, Kalpana, you're on mute.
Okay. Just give me a minute. Okay, very good morning to all of you. I thought I should say a sweet morning to all of you, since the talk is about diabetes. It is exactly 5 years since our Ministry of Health declared the war on diabetes. I think this is the first time Singapore is declaring war on something. And this year is very special to me personally because in the diabetic space, it's 100 years since therapeutic insulin was discovered. And also it's Diabetic Singapore's 50th anniversary this year. When I'm talking to you, almost 463 million people around the world are living with diabetes. And it's one of the fastest growing health challenges of 21st century. And when you look at MOH figures, we can expect 1 in 2 Singaporeans age 70 and above to suffer from diabetes. So I heard from Brian that today almost 150 people have registered. So once we all touch 70 years, I think 1 in 2 will be diabetic. And the gravity of the problem is more than that. 1 person dies of diabetes every 8 seconds. Okay, and the cost of diabetes, can MedTech bring it down? Okay, you can see Singapore, we spend around 1 billion each year in managing diabetes. And when you look at, I was just looking at the figures in a study conducted in 2015, 64% of the outpatient costs are included the physician visit, 23% is towards medication, 10% is towards laboratory tests, and allied health service is 3%. Definitely technology can scale this down, and there is no doubt about it. And especially when you look at the standards of medical care in diabetes, it's the first time a dedicated section on diabetes technology has been included in the American Diabetes Association standards of medical care. So this is how, everywhere technology has come in. And again, in COVID, it has forced us to go into deep dive into technology. So today we have an amazing panel. And this panel has brought together 3 speakers. And all the 3 speakers are in areas which are very, very important to a diabetic patient. Definitely a doctor, a clinician is very important. And again, when it comes to diagnosis, of course, for screening, in order to prevent complications, we also look at from Roche, who will be talking about the diagnostics platform. And again, we have food. Okay, food is close to our heart. And when I ask any patient with diabetes, what is more challenging? What causes them burnout is they don't know what to eat. So that's why we have Verlin talking about food. Okay, without further ado, I would like to introduce our first panel member, Dr. Suan To, who is the co-founder and medical director of Novi Health. Okay, she wears multiple hats: CEO, co-founder, medical director. So that's why I think we have got the best panel now, right? And Novi provides clinically backed technology-enhanced solutions for diabetes and weight management. And Dr. To has been the senior consultant endocrinologist at National University Hospital. And she's also a leading expert in the management of diabetes, lipid disorders, and metabolism and weight management. and she has got many awards, local and international awards, and also she sits on the Diabetes Research Task Force. And Brian Coe is the Cluster Head, Asia Pacific Mature Markets, and General Manager, Roche Diabetes Care. And Brian's mission is to bring true relief to people with diabetes. And he has been with Roche over 17 years, and he knows the ins and outs of diagnostics and what Roche has to offer in the diabetic space. Verlin is a chief food fighter and co-founder at Alchemy Food Tech, a Singapore government-backed food science company. In fact, very rare to find technology and food science merge, and that was a startup, and they are very successful startup. And she's very passionate to bring this to everyone who wants healthier meals. She'll be talking about, we'll also get to know about Alchemy Fiber, how technology was used to develop this fiber, and they have been everywhere. You look at Business Time, look at Emerging Enterprise 2019, Innovation Awards 2019. So everyone talks about Alchemy these days. Okay, now let's to the audience. Okay, you can also like put your questions in your Q&A. And now let's take our first question to Dr. Cho. Okay, as a clinician and as a researcher, you know, diabetes is one of the largest global public health concerns. What do you think are some of the issues that comes with trying to fight such a disease like diabetes? Okay, maybe Dr. Cho has some logging issues, so maybe I will pass the question to Brian. Okay, so in the case of this space, Brian, do you think as a global leader in integrated personalized diabetes management, how do you think diabetes care and management has transformed over the years?
Okay, thanks so much for the question, Kalpana. I think we have certainly come a long way. If we can, look back, more than 40 years ago, I think BG testing, as we all may remember, were largely restricted to doctor's office, right? And then SMBG became the, where testing of blood glucose from home became the standard of care. And then fast forward, about 20 years ago, CGM came into the picture, but a massive uptake of CGM was not really happening until about 5-6 years ago, right? Where everybody, started to, embrace the sensor-based technology as the alternative for, finger pricking. And in recent years, we have seen a plethora of digital apps, right? Which has the power of putting more data and information into the hands of the people with diabetes. What this really means is that, instead of looking at glucose measurement as one single value at a time, right? Putting all this different information such as diet, lifestyles and activities, their insulin intake, their oral intake.
Maybe even mood, right?
Yeah,
some
correct.
Even mood inside, yeah.
Correct. The mood, the stress level, all this helps to contextualize, right, the BG measurements, right? And it helps people with diabetes to be able to make a much better, more informed decisions to better manage their conditions. And in the last 15 months or so, we have seen, how powerful digital solutions can be to help connect people with diabetes with the doctors, in pandemic times, right? Where visits to the doctor's offices or hospitals were not quite possible, especially if the country is on a lockdown, right? So we have seen, right, the capabilities of digital solutions that were somewhat underappreciated in the past, but with the onset of COVID, right, we can see how much impact, how much difference it can help, right, in helping patients and also people with diabetes, healthcare professionals manage the disease, right? Even on a remote basis. So in my view, diabetes care has definitely gotten a lot better, but still it is still far away from ideal, right? Technology has certainly evolved significantly in the last 40 years, which allows people with diabetes to become more empowered and take more control and charge of managing their conditions. But to me, I think the improvements in therapy outcomes, in achieving the therapy goals, it's somewhat still debatable, right? If you ask me why, if you just look at the latest statistics about diabetes, just using the International Diabetes Federation's report, for example, right, the diabetes prevalence continues to go up, and there's a significant proportion of populations that are yet to achieve their therapy goals. So, I mean, we have seen a lot of advancements in medtech, in technology, but how much impact that has translated, right, in terms of achieving better therapy outcomes, that remains to be seen, in my view.
Yeah, actually that's true, because many people like 1 and 2 even don't know that they are diabetic, because
Correct.
they really don't even go and test, right? So with all these issues, maybe when we look at in the case of the food tech space, Berlin, when you develop some of your the fiber, alchemy fiber and all that, but do you think like what is the Singaporeans' perception of foods labeled as suitable for diabetics?
Yeah, thanks, Kalpana. So actually, before we launched our products, we conducted a focus group. So we did like the focus group covering diabetic and non-diabetic groups. So quite interestingly, what we found is that obviously in a like a pharmaceutical kind of setting, having products with suitable for diabetes speaks like directly to diabetics themselves. They can easily identify with such a product and they will purchase it. But for both groups, right, like both diabetic and non-diabetic groups, they actually told us that if it's on a regular, like a retail setting, they don't want to buy products that are labeled suitable for diabetes because number one, for the non-diabetics, they will feel that it is alienating them. Like they will, when they see a product that is labeled suitable for diabetics, they will think that I'm not diabetic, why should I buy this product? And then for people who are diabetic, they actually told us that, like in supermarkets or in restaurants, they don't want to be reminded that they are diabetic. They are like kind of living with the disease already. They know of their condition very well. So they don't want to be kind of reminded day in, day out about their illness. But instead, they will look out for healthier options to buy. So, like products with just health claims, like higher fiber, lesser sugar, etc. And then they can decide for themselves whether it is suitable for them. Obviously, they will read like the ingredient label, etc. And they can decide it. Yeah, exactly. So I think it's actually quite different for different types of people.
And that too, it's true. When I talk to the members of Diabetes Singapore, the support group, that's what they say. They also feel that, okay, as a family, when they go out to buy products, they don't want to buy something, it's just for them, So, and as a dietitian and being the healthcare space, we always educate patients. Diabetes diet is not a special diet. It is a healthy diet which everyone should eat. This helps to prevent obesity as well as prevent diabetes and also maybe reverse pre-diabetes. So you're right to say that, and that's the reason why EFSA also mentioned you cannot be labeling any product as suitable for diabetes under EFSA claim. So these are the things. Then maybe the other thing which Berlin, you would like to maybe address the audiences. Okay, for example, the food innovation space, what do you think are your challenges faced when formulating novel food products? Because whatever you do is something not in the mainstream space. You're doing something different so that you are addressing this issue. So what are the challenges faced?
Kalpana, I'm sure you will concur with me on this, but I think the most difficult thing to do is the taste of the food. So, to make tasty food is not difficult, right? I mean, like as evident with all the yummy food that we have in Singapore. But to formulate healthy food itself is not difficult. I mean, there are so many like healthier ingredient options out there, like buckwheat, whole grains, etc. But to make foods that are both tasty and healthy is really challenging. I think especially in Asia, where people here prefer foods that are softer, in the sense like we love soft white bread, we love fluffy white rice, and then now the latest trend is like mochi, which is again a highly glutenized starch product. These products will have a higher GI and it will obviously spike the blood glucose levels quickly, right? So to retain the taste and the texture of these foods, but yet at the same time, trying to look at how we can lower the GI, lower the sugar, lower the fat, everything. That I think is really challenging. So even for ourselves, like we have a whole team of food scientists and biochemists, and it's a lot of research to be done to get that perfect taste and like lower GI balance. Yeah.
Okay, now to Brian, I always like this quote, doing now what patients need next is also your core value. What can patients with diabetes expect to see in the coming years, especially with much support in personalized diabetes care management?
Yeah. I mean, in Roche Diabetes Care, our vision is really to help people with diabetes everywhere around the world, right? Not just in Singapore, to think less of their condition, their diabetes and therapy routines, so that they can get through relief day and night. One of the challenges of being a diabetic is that this constant worries and questions that you have in your mind the moment you wake up until the moment you sleep, right? About whatever I do during the day, how will it impact my glucose level, right, in my body? So this is a constant burden, right? It's a mental burden that persists, right, in every person with diabetes. Now obviously we know how complicated diabetes as a disease is, and we in the corporate level and in the corporates we also know that we can't treat all diabetic people the same way, because no two patients are exactly the same, right? Because every individual is different, whether it's in terms of biology, in terms of their lifestyle, what they eat, right? How they handle their stress level, and most importantly, their adherence, their compliance, right, to what the doctors tell them to do. So the need to personalize diabetes management, it's absolutely clear, right? And in Roche, we advocate this concept of integrated personal diabetes management solutions, where we aim to provide a holistic approach to diabetes management that is really patient-centric, right? Focusing on the person rather than what is the commonly available therapy plan, right, for people with diabetes. And we do this by offering connected devices. And as you know, connected devices, it has the capability to collect immense amount of data, right, which can then be used to generate a lot of insights that can be used to help personalize diabetes care with the aim of limiting or slowing down, right, the progression of the condition. What we do as part of this integrated diabetes management approach is also to strengthen our collaborations with the healthcare professionals, the patients, the payers, and also many other industry players, right? I think in the past, what we saw, it's patients, they visit their doctors, at a fixed schedule, right? Maybe once a month or once every 3 months, right? Depending on which country you're in, right? What happens in that doctor's office is typically, fairly limited, right? Because of the time constraints, right? The limited amount of information that is available, for the doctors to interpret, to really understand what's happening with the patients, with the person with diabetes outside the clinical office, right? So what digital solutions that are available in the market these days has helped to transform is that, the moment the person with diabetes walks into the doctor's office, right, that information, that insights, it's already presented in front, right, of the doctors, and therefore the doctors is able to quickly understand, right, how the patient has been managing his or her conditions, and therefore advise whether or not there's a need to adjust the therapy, right, depending on whether or not the condition is under control. Now, we believe that by doing all this, we can help improve treatment outcomes, right? Rather than asking patients, to take their oral drugs, X times a day and make sure that they adhere to the insulin therapy, for example. I mean, we will not be able to achieve, what we hope to see in terms of the therapy outcome unless the patients adhere, right, to the prescribed therapies. And we have seen that various governments around the world, including Singapore, right? We have poured in a lot of investments and money, right, to fight against the diabetes disease. Now, obviously, are we reaching the goals that we were hoping to see or to achieve? I think, as I've said earlier, it's questionable, right? It's still debatable. So we believe that by personalizing diabetes management, right, we can help, right, to improve the therapy outcomes, and thereby, helping to improve the sustainability of the healthcare systems.
Yeah, and that's why you're very right to say that when the patient enters the doctor's office, the doctor knows everything, Oh, what have you, like maybe the blood glucose levels, right?
Yeah.
Time in target, everything is right in front of the doctor. So it's going to be very personalized. In fact, you can just ask a few questions and the doctor can focus on mainly how do you improve the complaints of the patient? Because the technology really takes care of, also with the time crunch, the technology offers the solution right away. So that's why we should now ask Dr. To, as an endocrinologist, as a researcher and entrepreneur, okay, compared to those days of the current trend in diabetes prevention and management. So maybe you can just throw a light on how this technology has improved or enhanced your care for the patients. Dr. To, please.
Thank you, Kalpana. Well, I think everything all the other panelists have said so far holds so true, and it's so exciting as someone who I think as a young medical student or even doctor, never thought I'd become an endocrinologist, but was pretty much inspired by people that I know of and met along the way that really face these issues day in, day out. And it seems so simple, but it's complex. And I think part of what we need to do in that personalization now is simplify all these complexity the best we can in order to be able to provide more effective, timely, efficient solutions. And ultimately as well, technology hopefully can help us increase the efficiency such that the costs can come down and that more people can have access to these solutions. Whilst it's a tremendously exciting time and we have these new technologies, and I think even the appreciation for it is a huge starting point, but I think we have a long way to go still. I guess in part that's why we're all here today, not just the panelists, but all the participants, right? The size of the problem is so big and we need all hands on deck. I think to sum up then where the field is moving, definitely personalization is key. It is a person with diabetes, not diabetics. That's one of my pet peeves every time I see the word diabetics, because it's really people and each person being uniquely different. So why are we applying necessarily the same solution to each person with a common label, but actually potentially very different issues and problem, and the person also evolves and the issues and problems evolve at different stages and time as well. So there needs to be that personalization for the lifestyle and environmental factors, that because we're dealing with a condition that is associated with our behaviors on a daily basis, we need to be able to get those data points, right? And when it comes to the lifestyle, what type of foods they eat, the timing, etc. How do they move, physical activity. I think we're learning already and realizing sleep, stress, mental health impacts on physical health. And you can see that in the glucose profiles, very objective data points. And then when it comes to the medical care, I think as a doctor, it's so exciting that we are in an era now where we have so many more tools. We're not just looking at modalities that tackle the sugar as one endpoint, but really now the bar is so high for medications. You need to also show cardiovascular outcomes, improvement in key things that affect lives and whether people live and live well, right? So heart attacks, strokes, kidney disease, eye disease, etc. And now we're entering an era where we do have tools and medications like that. So there's also a lot of scope for personalization of the medications tailored to each individual based on their unique, not just biology, but how that biology interacts with the environment. And underpinning that, I'd say, is where technology comes in, because how do you then integrate these different data points? And I think Brian did an excellent job of talking about, the platforms that companies like Roche have been doing, and that's really wonderful and saves so much more time and lowers a lot of barriers from a provider's perspective. And then we have people like Valine who are making it simpler for people to really make better choices for themselves without compromising quality of life. And I think these are some examples so varied of how technology can really be a key enabler for us all to achieve that objective.
Yeah, I think you rightly put it, even when I remember in Diabetes Singapore, we all think, okay, a charity, many people think, oh, charity will not be able to offer technology because it's expensive. But we have brought technology to the doorstep of the patient. We have the ALRT technology where they can do their glucose monitoring with predictive HbA1c. And also, even in centers, we offer technology to detect glaucoma and even macular degeneration, all within minutes. Those days you have to go and wait for hours to get the results. So that is the powerful, the power of technology. And I also very happy to see that this technology is embraced by everyone, including the patients. So previously, when you look at certain technologies, only one group of people will have to get it and the rest don't. So when you come to that, more and more technologies are available in the industry. But what do you think, which are easily accessible and available in the lower socioeconomic group? When I think of these 3 A's, okay, which is availability, accessibility, affordability. Is that possible with this technology? Maybe this question is for all the 3 of you, Maybe you can, Dr. Toh, you can just, as a clinician, do you think the 3 A's are possible? How do you address the lower socioeconomic groups?
Well, Kapana, that's one of the reasons why I transitioned. As you know, I'm still affiliated to the public sector in some and many ways, but that's one of the reasons why I've taken a path perhaps less trodden and founded a startup called Novi Health together with Dr. Joanne Tay, who used to be with the Ministry of Health leading the war on diabetes, or the Diabetes Program Office, along with Dr. Carl Tan, who's a preventive medicine specialist. And we work together in the various initiatives at a population health, regional health system level. And we really sought to validate this hypothesis, right, Kalpana, that yes, we know all these different components need to come together, but then the tools can be expensive, right? But then I think the other stakeholder here is the payer. And I think that's why healthcare has been so difficult to potentially crack for health tech companies, because it's not just a bi-directional relationship between the user or the consumer and the provider. The consumer may or may not be the payer. You then have governments as payers, insurers as payers, co-payment systems, et cetera, and all the incentives or objectives need to be aligned. And somehow we need to find a model and a financing model that's sustainable. So I think at Novi, we are seeking to test and validate that hypothesis that it can be achieved. I think step 1 was just validating that if we are able to integrate the lifestyle and the medical data points effectively, can we then achieve even diabetes reversal in more people, right? Minimally remission in those that are early diagnosis, and in those that already have complications, control and some degree of reversal even in early complications. And of course, those with prediabetes, prevent them from developing diabetes. And do these components really make a difference? Can we achieve that outcome? I think we're there. We've validated that. We show that it can achieve that outcome. And then next is then, can the cost be affordable? Well, we're currently priced very affordably. You can go to websites and see what they are for a 3-month bundle of care with monitoring, with the service provision, the coaching, and the app. It's a fixed price, and there are, I guess, certain portable subsidies like CHAS that have really helped. And I think that's where all hands on deck, right? We need to take baby steps. And I think as players in this ecosystem, we need to then pull together these various pieces and see how we can translate them. And we are testing them, also gaining acceptance for, it's a new concept. So I think one of our challenges, which going to medical school never equipped us to do, was how do we even communicate and increase awareness for what these products can do for you, and how do we better understand what's the willingness to pay and what's a fair price point. So I'm optimistic. It's not easy, but I'm really optimistic. And that's the problem that we keep working on, trying to contribute to solving each day.
Actually, that's true, we're definitely optimistic. In fact, future is now. Okay, we never thought COVID would push us beyond this, right? So we can see patients now are very comfortable to talking to their doctor or dietitian, their coach, just on Zoom. See, everyone knows to use Zoom. That itself, you can see the power of technology even now, right, in this space, right? So we are all well connected. Then again, let's hear from Brian. Brian, as a technology company, how do you address this issue? Do you have any plans, like when you put up like technology platform? Do you even consider the economic status of the patient?
Actually, to be frank, Kalpana, I think the affordability is not really an issue all the time, right?
Okay.
Because if we are able to leverage on the scale, all right, of the number of users of the digital solutions, I don't think affordability can be a barrier, especially in high income countries like Singapore, right? I mean, Singapore, I think we can all agree that it has an excellent healthcare systems, but unfortunately, this is not the case, right? In many other developing and frontier countries, which are decades behind, right? And we are even talking about how to provide basic access to blood glucose meters and strips, right, to the people who need them, right? This still, until the present time, is a huge challenge. And that is why Roche is committed, right, to providing access to care, because it ties in very, very nicely to our vision of helping people with diabetes around the world experience true relief. So what we do is we partner with many other healthcare players and governments to run special initiatives, right, to help overcome barriers to access, right, to things like basic diabetes management solutions. But okay, coming back to Singapore, I think in developed countries, right, such as Singapore, affordability, like I said earlier, is not the only issues that we have to battle with, right? I mean, for new technologies, especially digital medical devices, there are several other challenges that we have to confront with. I can name you a few examples. Right? Number one is regulatory clearance, right? Often because the technology is new, right? I mean, that there's also a need, for the authority to better understand, right, the efficacy of such a solutions in helping to improve therapy outcomes, in bringing about the promised medical benefits, right, if you can say it that way. I mean, there are some other jurisdictions, especially in our region, where regulatory clearance does not happen, right, until that product has received, right, the approval from the FDA, or it has received the CE mark, right, because they want these jurisdictions, right, to be endorsed, to see the endorsement from the other developed countries first before they start, considering the approval applications for such a solutions locally, right? And then there is also a question of funding, right? The reimbursement for digital health intervention tools, which is still until today not yet a common thing, although there are so many real world data and evidences that have confirmed their efficacy in improving treatment outcomes when you combine digital solutions with the traditional therapy, right? So this is something that we have to work together with the payer systems to help see how we can complement, right, the traditional therapies with new technologies that have shown a lot of promises, right? And these are already happening in many other countries such as the US, or in the European countries. And lastly, perhaps one of the biggest challenges that medtech companies like us often face, when trying to launch medical device solutions, it's often the topic of data privacy, right? And this is always at the center of attention.
Yeah, that was supposed to be my next question. I was thinking of data privacy.
Yeah.
So using this, right? Yeah.
Right. So this is often the contention that we have to deal with, right? How do we bring about the promise of all the benefits that digital medical device can potentially bring, right, to improve the way diabetes is treated, versus the need to protect the privacy of the people with diabetes, right? And in many countries, we see that there is a need for us to build the local infrastructure, right, to host, right, all these patients' data, right, that falls within the jurisdiction of that country, instead of allowing those data to sit on the cloud somewhere, right? But certainly these regulations needs to be respected, but we need to recognize that when companies are required to build that infrastructure locally, and we have to replicate it every time, right? We want to launch a similar solution in every different market. There is a cost associated to building such an infrastructure, and then that correlates to the topic of affordability that we were just talking about. So I think we need to find a more workable solution here, right? To see how we can, really expand, the availability of digital solutions and put them into the hands of doctors, into the hands of the people with diabetes, so that they can benefit from it, right? Whilst at the same time, we also need to consider how we can protect their data privacy, and that will also help at the same time, to reduce the potential investments that is required, right, if we have to do it otherwise.
Yeah, I think you rightly put it, the regulatory framework. I think that's a major challenge. And but compared to like maybe 5 years or 10 years down the road, and now it is, I think everyone has understood that it's getting better and better. I think, Ryan, you'll be, we are able to see that, I suppose.
Yeah.
Okay, now back to Berlin. The association between food insecurity and diabetes has been very well researched. When Alchemy considered developing your novel fiber blend, did you consider this, and what are your thoughts moving forward?
Yeah, so actually food insecurity is definitely an issue that affects like all different societies, be it like in Singapore where we are much more developed and much more affluent, and also like very poor cities around the world. Trying to make the foods affordable is definitely key. Like at Alchemy, we try to make our products affordable for the mass population in Singapore. So I think we're talking about the middle income group in Singapore. And the cost of our product, like our flagship product, which is Alchemy Fiber for Rice, which is currently being sold in over 200 supermarkets, right, is about actually a cup of latte per month. Like, if you're breaking it down to per serving per person, and, like a rough like 20 days consumption at home, it's only about a cup of latte per person per month. So we feel that that's quite affordable. But however, we understand that there's obviously still groups of people who can't afford healthier solutions, as healthier solutions also tend to be more expensive than the regular food. So in our efforts, we have worked with our investors, such as Heritas, through their Heritas Cares program. And we have also worked through our partners like Boon Tong Kee Chicken Rice and Swee Heng, the bakery shop, to give away even healthier chicken rice or healthier cakes to old folks' homes via CSR efforts. And we hope to do more in the future. So I think like getting the innovation out to everyone is, it's obviously challenging for all companies, but I think we can, with economies of scale, with this mass production, and obviously with more partnerships, we hope that we can get solutions out there to people as much as possible.
Thank you, Berlin. You rightly put it down that I can see that you are really reaching out to even the masses. When I saw your chiffon cake in Swee Heng, that's actually like something like a neighborhood bakery, and now it's very popular. And so you have done a great job, and we hope to see that with your other products which are launched. And now to Dr. To. Okay, I think you are a very, very famous physician in the diabetes space. Do you think AI will partially replace the physician roles? And also, how do you strike the right balance in engaging patients through digital tools without losing their personal human touch?
Yeah, okay. I get asked that question quite a lot, and I really don't mean any offense to people who work in AI at all. And I think in some ways we are trying to build AI, but a lot of people ask us, "Oh, is Novi a AI for diabetes company?" I said, that's our vision, and that's what we're working towards. But I think today a lot of AI, artificial intelligence in healthcare, is a lot of A and very little I. But do I think that there will be and is a role for the future? For sure. Okay. Why? I think today a lot of the analytics and algorithms can help us to increase efficiency, right? So a lot of work, for example, in the integrated platforms that Brian and others are working on at Roche, really directly contribute to that. And that way, then if you think about it, if one physician or one dietitian or one care provider today is limited by how many minutes they can spend face-to-face with a person, if they have all that information in front of them, they don't have to spend so much time asking all those things. They've saved a lot of time. It frees them up to do things that they can uniquely do, which is integrate those data points, come up with an assessment, and recommend things, right? So that increases efficiency. I think what we are trying to work towards in the long term is imagine, then I'm no one special, but I try my best, right? And so do a lot of other care providers out there. They all try their best and they all have their strengths and we all have our limitations. Now imagine if we can bottle up objectively, egos aside, no best doctor, but best practices. And we can then build that into algorithms that truly then now no longer just enhance the efficiency of care, but also efficacy. To me, that's what AI really means in lay person's use case terms. And not forgetting, it's not just the doctors, right? In our team, I learned so much from my dietitians, nutritionists. I never realized they are different things. I'm sorry, right? But now I know and how important this is, because if you suffer from a nutritional deficiency, of course you don't feel good. Of course you're not good, and it's reflected in objective data. But sometimes I think as medical providers, we look so myopic, with such a myopic lens of certain things that we miss out on these potentially easily addressable, cheaper solutions that actually can be even more effective. Not forgetting also the fitness coaches, right? All these things come together, and then now mental health, sleep, etc., etc. So in short, do I think AI will have a role? For sure. Do I think AI will completely replace doctors? No, but I think that AI will play a critical role in freeing humans up, doctors and more, right? And more providers, to really focus on things that they can uniquely do. And not forgetting then that human connection. That's why even though our coaching solution is digital, we always have, and there's an art as well in terms of pairing the right human that can make the right connection with the fellow human that we're trying to serve, right? So I think in short, it will never completely replace humans, but it will free humans up to be able to do what humans can uniquely do.
Yes, that's why it's a value-based. See, that's what value-based care is, what everyone looks forward to. So when this value comes in, they also want, patients want the doctors to appreciate them. Call them with your name. When a patient walks in, if you address them with their name and you don't forget, okay, that itself is, something, immediately open them up, right? So maybe all these tools will give you the space and time to interact personally with the patient. And that's what they're always looking forward to. Maybe then, due to lack of time, I have just last few questions. And audience, please, this is your time to ask questions. Get your questions ready, and I will just ask a few last questions for the speakers. Okay, in the case of Brian, what do you think is Roche's role in driving innovation to the next level? Do you support startups?
That's a very good question, right? Especially if we are, since we are in this panel discussions, looking into potential use of technology and innovations, right, to help better manage diabetes. I think we can all agree that diabetes is a hugely complex disease, right? It's very behavioral driven, and as a corporate, we recognize that we can't possibly develop all the diabetes management solutions internally, right? And one way we try to tackle this is to seek external tools, right, services or approaches, and we call this open innovation, right? I mean, in other words, innovation is not limited or restricted within our internal R&D, right? But we wanted to, open this up and explore what there could be other better ideas that are sitting outside the Roche office or the Roche R&D centers that potentially we can partner with, right, to help bring them, into the hands of the people with diabetes or even the healthcare professionals. And we do that by running various incubators and also accelerator programs. And very often this involves startups, right? And the ultimate aim is to see, whether we can jointly develop a solution, right? And that we can use as a pilot, in one of our markets, right? I mean, we have done this in recent years, and we collaborate with organizations such as Mental Health, Plug and Play, and these are all very renowned organizations because they have all the contacts and networks with the startups. And what we do is, right, we reach out to them, and they can immediately connect us with with the relevant startups, and that resonates with the challenge statements that we have. Yeah, and also in markets where we see local solutions, provide a better fit, right, to the local needs, we will not hesitate to collaborate with the owners of these solutions. And typically these are startups, right? And they provide additional offerings such as coaching services, as well as digital solutions like apps, right, which are very tailored to the the local context. For example, the language, the food, and ultimately the aim is to really bring all these solutions and make them available to people with diabetes to support them, to better manage their conditions.
Yeah, that's a very good news to hear. And also Berlin will also share with us how, as a young entrepreneur and a startup, what are the avenues open with funding and so on. Maybe Berlin, can you just help so that in the audience, right, any of them you can inspire them also to start another food tech company?
Yes. Actually, there are some research grants, I think, available that interested innovators can tap on. So for medtech startups, I think there's this program called Jumpstart, which is short for Joint University Medtech program. So I think that's something that, of course, I'm part of the NUS Enterprise portfolio company as well. And from what I understand is that there's a few startups there that was part of this program. And there are also other ones that are maybe like more suited for public healthcare professionals. So they can tap on grants from National Health Innovation Center, so NHIC. I think they have like various types of grants suitable for different applications. And for other startups, you can also tap on Enterprise Singapore. So they have like one of the grants that actually we received as well is this grant called Startup SG Tech. So there is both the POC, which is the proof of concept, and the POV, which is the proof of value grant. We received this grant back in 2016 or 2015, 2016. And we were at that time we were the first food tech company to receive this tech grant. So most of the companies that were supported under this grant is definitely in this space, where we're talking about med tech, clean tech, advanced food tech, etc. So I think there are many available opportunities out there for interested or budding entrepreneurs to tap on. Actually, with SGInnovate also offer co-investment with various VCs. So, if you're really looking at innovation, yes, there is avenues out there. Just go and reach out to them, share about your idea. Don't be afraid to share about your idea, in fact. Get feedback and just get going.
Yeah, thanks, Shirley. And actually, that also tells me I should become an entrepreneur soon. Okay, now to Dr. To, like this question, I don't want to put you on the spot, but I've always been hearing, there are a lot of challenges. Most healthcare professionals unwilling to collaborate with pharmaceutical companies or private food companies to avoid showing biasness, which is something akin to product endorsement. And this, I think, may be holding back the progress in the fight against diabetes. If you think it's yes, what can we do to change this? Or if you say it's no, so what are your thoughts about it?
In short, I would say it's a no. And I would posit, so viewing it from the following lens, right? I think as healthcare professionals, we have a responsibility and regulations around codes of conduct as well. And it's our job to offer a professional opinion that's unbiased, that is best suited to the person that we are helping or assisting or supporting or taking care of, right? And so it doesn't mean, though, that that means that we cannot work with private players because you're part of the solution and you're part of an essential part of the solution, right? And so how do we do that? Well, so simplistically, I mean, I sit on Open Declare, a number of advisory boards for pharma, for medtech, for everything. And it's not because of the monetary aspect. It helps keep me also abreast of the latest developments and help me do my job well when I'm trying to serve either the one-to-one or the one-to-many lens. It also, I hope, provides a voice for the patients that I serve back to these stakeholders, so they are acutely aware of some of the other considerations that go beyond their product and marketing, and pricing, I guess, comes up as well, etc. Right? So this two-way process is really, really important. Now, I think that's where I talked about from the beginning, looking at it from the right lens, because I think if we go into it with this sort of sense of, oh, awkwardness or distrust and cannot do this, cannot do that, it may already impact on how we interact with each other, which is not necessary and perhaps also unhealthy and doesn't benefit patients. But if we go in there with that understanding, I respect your responsibility, you play an important role, you respect mine, I play a role as well, and ultimately we're all trying to serve people, the same groups of people. How can we work together? And when we interact, not just in what we do, but how we do it, we find ways to do it, fulfilling those responsibilities and actually paving the way forward. So I don't think it should be a hindrance, but I think if we go into it with the right mindset and with the right actions and the way things are communicated as well to the end user, I think then there are ample opportunities to do good things and work together.
Yeah, that's very, very good to hear that, because, and also maybe the collaborative efforts will definitely pay us or move us forward in this space. So now,
sorry, Kalpana, maybe on that note, I'll just say one thing that helps though is just objectivity and data, right? So I say, like a lot of times someone comes to me, or a company comes to me, oh, can you, I said, look, if you have a good product, right, and you've got the data and the tools to communicate that, I'll assess that. And professionally, if I think actually there is a role for this segment or whatever, then I'll just communicate that objectively, right? And that is way more useful to you, whoever your private player is, right? Than if someone was overtly selling your product, because consumers are smart, and you are a consumer yourself. You'll be able to tell what is pure fluff and marketing versus what is marketing to increase your awareness of a product that really meets your needs.
That's what I always tell some of our collaborators when they come to us to do novel food products. I always tell, first, if your family eats it, then it can be sold. Okay, that is the first benchmark, we have to believe in the product before even they ask us to endorse the product. Okay, these are some things. And from the audience, I think there is a question: how do you change the behavior of patients, especially when checking BGM, any possibilities of non-invasive solutions which might help to motivate them to track or monitor their blood glucose? Maybe Brian, would you like to say any non-invasive solutions, and maybe Dr. Do can add on to that as well?
Yeah, I think from a device perspective, I mean, my personal opinion is no device in the world can possibly change habits or behavior, right? Unless we find the right motivations, for the, if you're talking about people with diabetes, right? What can we do, right, to motivate or to encourage behavioral change? Now, non-invasive solutions, I mean, there are many research and developments happening around the world. I mean, in the past, we have potential of using tears, right, from the eyes, right, to potentially estimate the glucose level in the body, right? And recently, we have read news coming out from Australia, where saliva can also be used, right, to estimate, right, the glucose level in the body. But all these are very promising innovation technologies. However, they have not reached a stage, where healthcare professionals are comfortable to use them, for as a way of managing diabetes. Now, to me, no matter how innovative the solutions is, right? It's very difficult to change a person's habits, right? Habits that have been developed for the past 20, 30, 40, 50 years, right? But what is really needed is a constant nudge. And this is where we believe digital solutions can help, right? It can help to remind, it can help to contextualize, right, your glucose data points versus, you know, what you have been doing in the day, what you eat, what you do, your physical exercises and all that. And therefore help the patients, I mean, to be able to see, right, their choices that they make on a daily basis. How does it impact their glucose level, right? That we believe it is the greatest form of motivation to help them understand, you know, the insights that the digital solutions can provide, so that they can use it as a learning to start, right? The important thing is just to start, right? To start changing their lifestyle and make it a habit, you know, from there on, right? So I think this is I mean, from a medtech perspective, this is what we believe in.
That's clear from the clinician's perspective. How do you change the behavior of patients?
I think the key word for me, from what Brian said, and which I completely agree with, is how it provides context. And that contextualization is key for people to see the value of why bother to prick themselves or wear a CGM device, because it provides them with actionable insights, and the context by which these glucose patterns or excursions are changing based on what they do, then shapes or informs their behaviors, right? And then we as providers spot these patterns and help them understand them, and again, contextualize it for them, communicate it in a manner that they can understand. So let's take rice, right? Whether it's, makan nasi, you know, jangan terlalu kena padankan dengan ayam, or musik kamu fana, or right? How you say it is also really important, right? And then for Alchemy Fiber, I think one of my earliest encounters with the team was when they were telling me about this product. And I mean, I'm very data-driven, and I think I really give credit to the team. I think they are so determined and they are so passionate about what they do. And I said, okay, I will try it myself, and I'll try it with people who are willing to try it and see what it actually does to the glucose levels. Is it different if I eat rice with and without Alchemy Fiber? And then you see for yourself, to your own circumstances, how your body is responding to different types of rice, and rice with and without Alchemy Fiber. And then you can be in a position to make good decisions. So to cut a long story short, I would say that how do you then encourage more monitoring, whether it's BGM or CGM? I think if you can help people understand the value of what they're doing and contextualize it for them, and then they see the benefits in terms of helping them make good decisions for themselves and maintain a good quality of life, then everybody wins.
Yeah, that's right. Again, personalized approach, you know. So when they believe in it, I think they'll follow. And again, the constant nudging, that's when the coaches come in, and the regular visits to doctors. And maybe that will be like some nudge will be definitely, they will change. And there's one more question to you, Dr. To, as well. From your experience, what are the key difference you observe between traditional diabetes MGT consults versus app-based program? Do you think the app-based program is the way to go forward? I think you also addressed this before. Maybe you can just like summarize it. Yeah.
I think that there's definitely a place for app-based programs, and it will likely continue to grow. Okay, but I don't think today we can say one or the other is the only way to go, because we just said personalization is key, and for each person there may be different modalities. After all, I think apps, they are tools. They are still a tool. And what is the tool meant to serve? The tool can serve to help you consolidate your tracking, to have nice dashboards that make sense so you can spot patterns. It can serve as a communication tool to connect with your providers or whoever, so you can ask questions, etc., be motivated or supported, or link up with your family or friends, etc., right? But it's a tool. And so you have to ask yourself, what is the tool meant to serve? And is there a use case for it? The reason I say I think it's just going to grow is for some of the reasons we talked about, right? We're trying to solve a complex problem, if everything purely involved a multidisciplinary team and face-to-face interactions, and a lot of you will be familiar with the diabetes prevention program, or the DPP, that showed clearly that lifestyle intervention can be more effective than a drug metformin in preventing the progression to type 2 diabetes. So we know lifestyle trumps drug in preventing progression. Then why is it that we just don't do it, right? And in the DPP, they showed that if you do it, you get better outcomes. But it was pretty intensive, a lot of face-to-face, 150 minutes of aerobic exercise, yada, yada, a whole curriculum, lots of face-to-face, you work out the cost. And even with that kind of very intensive and heavy cost structure, I think they've shown that it can still be cost effective because you see legacy effects in the benefits. What more now in the era where we are going towards digital approaches, where you can still maintain that human connection. You can have a combination of online, offline, hybrid approaches. You know there's a real person behind it. And now in the era of the pandemic, I think it's accelerated acceptance of that. We don't necessarily need to meet face-to-face anymore. We can do video, we can do app, we can chat, and I know you're real, and I know you have my back, and it can still work, and I would posit potentially work better. What that also potentially achieves is bringing the cost down, right? Then this time, like, that's what we keep a track on. Our coaching ratios can then increase, because now one person cannot just touch 10 people, 50 people, 100 people, but can potentially even touch up to 1,000 people. And that's how we also can bring the cost down over time with technology, with these efficiencies. So I'm excited about what the future holds, and I really hope that this dogma of like stigma that exists with diabetes, that it's a one-way road to complications, that's not true in 2021 and beyond. It's never true anymore, and we shouldn't have to live with this huge burden of diabetes.
Yes, definitely. I agree with you on that, because to me, I always say, that is why we don't call them as diabetics, okay? So it's a patient with diabetes, and always they have to look forward and live without complications. And I also feel when we started this session, we're thinking of war on diabetes. I think, have we won the war? Yes, we are. And then we will. And effective management of diabetes is closer than we all think. And that too with the spotlight on smart technology and our willingness to use it and empower ourselves. And also to just end this panel discussion, first is my heartfelt thanks to the lovely panel and also all of our audience, also for asking this thought-provoking questions. And to end with it, I think what is promising is digital approach will put a coach and a physician in your pocket 24/7. And so we will be winning the war on diabetes. Thank you so much. I'll now pass